I'm going to put my screen up shortly. I am an independent national health strategist. None of what I have to say reflects on any person who may employ me. It doesn't reflect on the UK's Faculty of Public Health, for whom I'm an advisor. What I'm going to propose is the need for radical change. COVID-19 adds to the challenges of higher education's role. I'm going to refer specifically to Sudan and Sudan's SDG health attainments and health needs. Existing higher education policy for Sudan was not going to fully address Sudan's health needs, and now the damage which has been done. Oh, stop! Can we go back to we need to go back to, yes, that's it. So yes, stop, please. So the damage done by COVID-19 has impaired not just Sudan's higher education as it stands, but it's impaired the need for multi-agency and national health sector capacity even more. And to address this, I absolutely believe that a much more radical revision of national health strategy in Sudan and the higher education strategy in Sudan is necessary in order to achieve Sudan's SDG health goals. They cannot be provided for by existing higher education policy for medical and health professions. And just to give you an example of that, if I say that this is all without criticism, I am merely saying what I've observed and what I suggest, is that, for example, Sudan will face a massive increase in cardiovascular disease, diabetes, and other problems with changes in lifestyle. These develop in the earliest decades of life. They are already present when people are in their 20s. But from my outside view, Sudan's higher education policy for medical and health professions has been focused on treating it when people are in their 60s, when their disease has already progressed to a stage at which prevention is not possible and at which treatment is possible. And that's when people have to take long journeys from out of state and into Khartoum, to Emergency Street, and to go and see doctors in hospitals. It is not preventively oriented. So what I am proposing is a national preventive health strategy instead. More radical than that, I am suggesting you turn your communities, your community leaders, please stop, don't advance the slides. You need to turn your young people not as consumers of higher education, but into health and education leaders for your country. Now, this is ambitious, but if you don't do it, Sudan will fall behind because there are so many challenges and so many health needs. You will also become prey to the predators from outside, the large countries who will want to sell you increasingly lifestyles and products that damage health, bad food, armaments instead of healthcare, bad habits, computer games to divert your young people away from education and into leisure. So what I'm going to propose is that doing the same old thing nationally in terms of higher education will result in the same old health, the same divisions. You are now in a unique position in Sudan in that you've had a revolution. So how easy it is for a foreigner to come along and recommend changes, especially in difficult times. Let me make it clear, I'm not criticizing your higher education. It has produced doctors who I know personally, many, who are internationally known as excellent doctors, and my country steals them. The welcome that I received in Sudan has given me an enduring love for Sudan, and I want to see your health needs met and its inequalities narrowed. And that's the only reason I'm saying this. What I'm saying is that excellent universal education needs to be supported now in Sudan by national policy that prioritizes education and health. You face huge barriers, I know, such as the internet, lack of electricity, and all the pandemic restrictions. But in a crisis, Sudan is now in the post-revolution phase, and you have an incredible opportunity to make national changes precisely because the world has changed, and you need to rebuild and refocus higher education to do completely different things for health, I say. I'm simply suggesting an alternative strategy. This is easy for me. I'm not there. I don't have to do it. I'm saying this is what I've seen. Education is the biggest influence any countries have on health and inequalities. Healthcare, far behind. Education is the thing. And I recommend investing on a major scale in order to improve Sudan's health. Make it sustainable by putting higher education into the hands of communities, not keeping it as something that a few people decide. Hand higher education and education for everybody over to community leaders, faith leaders, instead of a small number of people, and invite your citizens to engage in not just getting higher education, but in contributing and leading it. So what we know is from many countries is that having a few health professionals, no matter how fantastic they are, does not meet your health needs. Certainly it provides fantastic treatment for people, but that's not preventive. People are still going to get sick in the first place, and health professionals aren't going to stop them if they are focused on treatment. So what you need is a massive cadre in Sudan of new health leaders, health advocates, and health activists. I can't tell you how to do it. I'm an outsider. There's so much I do not know about Sudan. But my suggestions arise from my experience of working in Khartoum in 2015, 2018, and my strong interest in Sudan's health needs. So Sudan's emerging into a phase in which you've got huge opportunities, in which if you are bold, you will seize those opportunities, and you won't just say, oh, how can we do a bit more with fewer resources? That's 1970s US management speak. It's nonsense. It doesn't work. What I'm saying is Sudan is now in an incredible phase in which you could refocus. So the old ways don't work because the systems were inadequate to meet health needs. Your public health people in Sudan did some fantastic work of mapping national and proposing national health strategy. You have a national health plan. It was brilliant, but now you have fewer resources with which to do it, and you're all locked down. So it's not health problems. What Sudan faces is not a health care problem, but the problem of a multi-sector focus to bring the whole of Sudan's education and Sudan's ministries to work together to refocus on improving your health. So there is, could we see the next slide, please, Professor? There's a real risk of, thank you, there's a real risk of paralysis and setbacks. You've got major damage to all these things. Your hospitals are now overwhelmed by COVID-19. All the plans that you had to do immunization, they are damaged. And it looks like you should expect a very large increase in the deaths from malaria and the other communicable diseases and the others that you were already trying to deal with. There's also going to be rises in malnutrition and the consequences of people being unable to work all these things, they are not going to be addressed and changed by a change in the health professions, higher education. Could we have the next slide, please? What we need is a very ambitious higher education strategy led by ministers who will make changes happen. Yes, it's really important to turn out new medical and health graduates, but they're all focused on treatment. And what's needed is a new health system for Sudan, which is a preventive, primary care focused, and family medicine focused health strategy, and a health education system, higher education system, to absolutely support that. Because, as the old saying goes, the doctors are fishing people out of the river, and they are treating them, resuscitating them. But sometimes they have to say, who is throwing these people in the water upstream? So unless they are educated in primary health care and deployed to provide family medicine and an entirely, well, not entirely, a new cadre of primary care professionals all across Sudan, not focused in cities, focused in community health centres, then this will not happen. And you won't do it by making a few changes in universities to curriculum. What you need is, you need to harness the energy of your young people and to educate them and make them health literate so that they understand, but also so that they can become the advocates for change. You need your faith and community leaders, all those people throughout Sudan who can change and influence public opinion. You need them to be leading this and saying this absolutely must happen and we will support it. Could I have the next slide, please? Yes, it's hugely ambitious. What you need is health minister, higher education minister, ministers for all the sectors who will say, okay, this is not easy. We will have to fight off many challenges, but we will do this. Because unless this happens, Sudan will still face all the old challenges, and the old ways of working will not meet them. So what I'm proposing is that, just as in my country, we have many, many very affluent people who are sitting and blogging and saying, oh, isn't life terrible? It's so hard for me at the moment. But they're not saying life is so hard for the population. They are not saying, so I'm going to give a big piece of my money to do this. There is this huge opportunity for people who have wealth, even if it's just a few of them, to say, you know what, I'm going to sponsor a university to change. I'm going to invest even just 10% of my money in higher education. I'm going to sponsor a whole load of family medicine doctors to do this. Now, these are quite radical. Could we have the next slide, please? What we need is, Sudan needs health protection. It needs an entire, not just a cadre of health protection specialists, doctors and health professionals. It needs a whole load of people throughout the states in Sudan to understand health protection and to be able to make it happen. Because health protection is not about treating people when they're ill. It's about saying sanitation. The health sector can't do that. That has to be up to a different sector. You need action on the wider health determinants. Education is the biggest one. Housing, transport, and the environment, of course, which damages people's health and continues to do it. You also need to have people who can influence your country's food and to say, Sudan has centuries of good traditional food which keeps our people healthy. The last thing we need is large countries trying to sell us new lifestyles and unhealthy foods to replace our traditional diet. So this is why, another reason why I say you need health advocates all through your state, all to influence families, people, communities, etc. You need health improvement, and you need to redistribute your health resources across Sudan. So instead of training some of your universities and medical schools, training people to go and work in the specialties in the big cities, what you actually need is them to turn out lots of health professionals who will actually work in the places close to people's homes, in community clinics, in people's homes, where they can advise those families on what to do about their health. Next slide, please. Can we go to the next slide? You need a national mobilization of people. You're not going to address malaria via health professionals. You're only going to treat malaria. So you need to radicalize your higher education to empower so many people in Sudan to understand about what is it that improves our health. And you need a load of new leaders for health and your higher education needs to equip these people. Next slide, please. Yes, I've dealt with that. I think what's going to be important, I don't know how you will do it, but Sudan needs not a small localized higher education program for health professionals. It will need in some way massive online learning for all people in how to avoid illness, how never to get sick in the first place, so that they don't have to go to hospital and spend money for transport, out of pocket expenses for all those health tests. So there is this massive challenge in the post-revolutionary phase to create online learning for young people to understand this and not leave it up to health professionals who are already in their 30s and 40s and 50s. You need young people to be leading this. Next slide, please. So what I suggest is refocusing medical and health education towards a preventive approach. You need a new climate in Sudan's health education system in which primary care and prevention are given equal status to treatment. And you really need a large training in family medicine to provide people with healthcare close to where people live. Next slide, please. My country, you can learn from my country in two ways. Please, the next slide. My country made a massive, brave medical decision in 1948. A small group of inspired leaders in the government set up the UK's greatest ever national achievement. And this was a national health service free to everybody. And it was based on primary care. Everybody could see a doctor close to their home. The doctors learned how the family's history. They knew the children. They learned the generations and how that family worked, and they worked to improve those families' health. You can learn from the mistakes of my country. For the last 10 years, my government in the United Kingdom has completely ignored public health advice of all kinds. They have not invested in preventive care. They ignored pandemic plans, but the main thing is that they have not invested in the multi-sector education which was needed to narrow the health inequalities. So now in my country, because the government has never invested for the past 10 or 15 years in higher education for all young people, it is now impossible for the poorest young people ever to get into university education. Do not copy this mistake. Learn from the mistakes of my government. Next slide, please. In the 1960s, 1958, 1959, one small country, this is Cuba. I'm not advocating you follow their political system, absolutely not. What they did was they set an example. A few people with vision said, we're not going to have a country in which the health of the few and the well-being of the few matters. We're going to make it a country for everybody. They rolled out a national system in which thousands of educators went out and taught people throughout the country how to read and write. They invested in preventive primary care. They equalized income. Everybody was poor, but they instituted a pension. They invested in free maternity care, and they set up a national primary care based preventive care. They now have one of the world's leading vaccination programs, and they've done this. I'm not advocating that Sudan does what Cuba did politically. I'm saying one small country made imaginative, radical steps, and their life expectancy actually exceeded that of the United States of America with its massive wealth. So don't believe you can't do these things. In India in 2011, I was very privileged to meet a health leader. This is Dr. Evita Fernandez, who runs a chain of hospitals. And she said, what we need in India is midwifery. We have a maternity system in which women are put through basically an industrial process. Their needs are not respected. Healthcare is abusive, and they are increasingly subjected to interventions not supported by evidence. What she did was to say, I want this to happen. I'm going to put my money into the development of a midwifery pilot. I was the person who designed that midwifery pilot. And since 2010, thanks to one person, Dr. Evita Fernandez, investing her own money in a higher education program to start and try midwifery, 11,000 women in India have now had choice, compassionate, kind midwifery care, and fantastic maternal health outcomes. So it took one woman, one strong leader, to say, I'm not going to rely on a government to do this. I'm going to invest my money. Next slide, please. Finally, I'm going to reiterate what I said, that it is now the only way for a country to increase health and life expectancy is really to change its education and extend higher education and education to all. At the bottom of this slide, you can see something called the Common Good Forecaster. Click on this link, find it. It's the Common Good Forecaster produced by United Way Worldwide. This, in 10 years of my public health practice, I have never seen anything so brilliant. I'm so envious of this. If you go to this website, you can see what happens in the United States. I know they've got loads of wealth, but it's the same principle in any country. If you go to this website, you will be able to project what happens when a country directs all its higher education and its education for the benefit of the whole population. It doesn't say we're only going to have a few graduates make use of university education, because what happens when you do that is the life expectancy in the country goes right down. The health inequalities widen massively. You have huge premature mortality. You have massive crime increases, poor mental health, and a massive rise in things like low birth rates. If, on the other hand, you extend higher education and education more widely to as many people as possible in the country, you will make huge improvements in your country's life expectancy. Education is the biggest thing. If you don't believe me, go to this website and try it out. It is absolutely the best illustration that I've ever seen of what happens when you make radical changes to education. Next slide, please. Now, I'm going to stop in 2 minutes. During the pandemic, we have seen some of the world's billionaires get much more wealthy. What we've seen is one or two of them say, I'm not going to bemoan how hard life has become for me as a poor billionaire. I'm actually going to put some of my money into useful things. I'm going to use it for the common good. So I'm not going to sit in my mansion. I'm going to give a big chunk of my money, and I'm going to give it to people who can use it to extend education and health professions education and preventive care. I'm going to give it to buy vaccines for big chunks of the population. This is a challenge. Argentina said, "Oh, I don't think we'll make it voluntary. We will put a 1% tax on our wealthiest people. They won't notice it because they have so much money. We will use it to help the poorest with the pandemic." Now, the health inequalities in Sudan they're not an inevitable thing. They are a product of the choices you make in how you organize government and the decisions government makes and what the ministries do. So what I'm suggesting is that you now invite lots of your wealthiest people to say, I know that when the pandemic ends, it'd be really nice to have some really big weddings. But actually, weddings are not going to make a difference to Sudan's massive health needs. They're not going to stop children dying from respiratory diseases and from the old neglected tropical diseases. So perhaps instead of making choices about investing in the well-being of a few, I invite people to invest in higher education in Sudan and to extend health leadership education to lots of community leaders, faith leaders, and young people in Sudan who can become your health leaders of the future. So without it, nothing will change. Next slide, please. I think this is the last slide. It wouldn't take much money. It really would not take much money to do it. It is simply it will be the product of how you choose to organize what your country does with its money. You can send your money abroad. You can make decisions about what you buy, and you can make decisions about what you invest in. I'd say invest in higher education, invest in preventive primary healthcare, and in leadership, extend leadership to as many people as you can, and invest in your higher education in order to do that. Last slide, please. That's it. My opinions are purely my own. I'm quite aware that it's so easy for me to sit here and say, oh, you should do this and you should do that. But I'm doing this because I care passionately about Sudan's health needs. And I believe that to address them, higher education needs to focus on multi-sector action and a completely revised higher education and education system to transform your country. And you are in a political phase where you can do this. So many countries around the world are stuck. They've got outdated political systems. My own country, the UK, it's not going to change. Sudan, you have a massive opportunity to change, and I look forward to seeing it. And I think that's quite enough.
So please remember, if we all help and do a little bit, it will make a big difference.